Hi everyone. Let us discuss about Shigella. First of all, the morphological characteristic of Shigella. Shigella are short from bacterium, so gram-negative, and morphological structure also rod-like structure. About 0.5 into 1 to 3 micron size, non-motile, non-sporing, non-encapsulated bacterium. It possesses Pimbriae. Cultural characteristics of Shigella. Shigella or errors and facultative errors with a growth a temperature range of 10 to 40 degrees Celsius and an optimal temperature of 37 degrees Celsius, then favorable pH conditions 7.4. They grow in ordinary medium but less readily than other enterobacteria. After overnight incubation, colonies are small, about 2 mm in diameter, circular, then convex, smooth and translucent. Occasionally on primary isolation and frequently in subcultures, a proportion of the colonies may be of the rough type. Colonies on Leconte agar or colorless due to the absence of lactose fermentation. An exception is Shigella sole, which ferments lactose late and forms pale pink colonies. Deoxycholate citrate agar and xylose lysine deoxycholate XLD is used to force a selective medium in which Shigella do not have a black center as against Salmonella, which appear rich with a black center. Growth is inhibited on Wilson and fly bismuth sulfide medium. Resistance, Shigella are not especially resistant. They are killed at 56 degrees Celsius in 1 hour and by 1% phenol in 30 minutes sufficient. In ice, they last for 1 to 6 months. They remain viable in most environments for days but die rapidly on drying. In pieces, they die with a few hours due to the acidity produced by the growth of coliforms. Shigella sole is in general more resistant other than other Shigella species. So this is a simply depict the biological cluster of Shigella. In antigenic section, Shigella possesses one or more major antigens and a large number of minor somatic antigens. Some strains possess K antigen. These are not relevant in typing but may sometimes interfere with accumulation by O antisera. Pimbrian antigens are also present. In general, the antigenic structure of Shigella is simple compared to the complex structure of Salmonella. There is considerable antigenic sharing between some members of the genus as well as between Shigella and equally common Pimbrian antigen may also occur, particularly in Shigella plexneri. So it is therefore important that the identification of Shigella may be made by a combination of antigenic and biochemical properties and not by slide appellation alone. So the classifications of Shigella are classified in 4 species or subgroups based on the combination of biochemical and serological characteristics. Serotypes are distinguished within the species. So this is the image also depict classification of Shigella. Shigella dysentery. This species of mannitol non-fermenting bacilli consists of 10 serotypes. Type 1 is the bacillus originally described by Shigella. It is negative and is the only member of the family that is always catalase negative. Shigella symmetry and Shigella soni are invariably catalase positive, while among other Shigella species, some strains may be catalase negative. Shigella dysentery type 1 forms atoxin sugaroxin, the earliest example of exotoxin produced by gram-negative bacillus. Three types of toxic activity have been demonstrated in Shigella culture filters, such as neurotoxicity, endotoxicity, and cytotoxicity. Shigella flexneri group B, this group named after Flexner, who described the first of the natural fermenting Shigella from lipids. This group is biologically heterogeneous and antigenically the most complex among Shigella. Based on type-specific and group-specific antigens, they have been classified into 6 serotypes, 1 to 6, and several subtypes. So these are the subtypes: 1A, 1B, 2A, 2B, 3A, 3B, 3C, 4A, 4B, then 5A, 5B. In addition to antigenic values called X and Y are recognized approximately, which makes the type-specific antigen. Serotype 6 is always Indo-negative and occur in 3 biotypes, some of which form gas from sugar. Shigella boydii. This group consists of dysentery bacilli that resemble Shigella flexneri biochemically but not antigenically. The group is named after Boyd, who first described these strains from India in 1931. 15 serotypes have been identified. Shigella boydii or isolated least frequently from case of bacillate dysentery. Shigella soni, this bacilli first described by Soni in 1915 in Timor, ferments lactose and sucrose late. It is Indo-negative. It is antigenically homogeneous but may occur in 2 forms, phase 1 and phase 2. The later forming colonies that are larger, flatter, and more irregular. Organisms in phase 2 may be isolated from patients that are more common in convalescents and carriers. Shigella soni causes the middlemost form of the bacillary dysentery. In many cases, the disease may only be a mild diarrhea. However, Shigella soni infection persists as the most common shigellosis in advanced countries. Shigella soni is serologically homogeneous and is classified by Colicin type into 26 types. Pathogenicity: Shigella causes bacillary dysentery infection occurs by ingestion. The minimum infected dose is low as few as 10 to 100 bacilli are capable of initiating the disease, probably because they survive gastric acidity better than other enterobacteria. Invasive property: enteroinvasive E. coli. Their pathogenic mechanism resembles those of organism binds to M cell, invade the lamina propria, than the neighboring enterocytes from the bottom basolateral surface. Bacteria grow and induce actin polymerization that pushes organism laterally into neighboring cells, where they continue to spread, causing cell death and inflammation. Inflammatory reactions develop with capillary thrombosis, leading to necrosis of patches of epithelium, which of leaving behind transverse superficial ulcer. Exotoxins The Shigella dysentery type 1 forms an exotoxin would appear to be much less important in pathogenesis than the ability of bacillus to penetrate and multiply in colonic mucosa. Non-toxinic mutants can still cause dysentery but not non-invasive ones. It also known as Shigella toxin, Shiva toxin or virotoxin, which is similar to E. coli toxin. It acts by inhibition of protein synthesis. It has A and B subunits. They can be tested by toxicity in virus cell lines. Virotoxin. This may be due to the LPS of gram-negative cell wall. Dysentery dysentery. The disease has a short incubation period, 27 days, usually 48 hours. The onset of clinical course or variable is largely determined by the virulence of the infecting strains. The main clinical features of frequent passage of or loose or scanty feces containing bleach and mucus, along with abdominal cramps and meniscus. Fever and vomiting may be present. Complications are more often seen in infection with Shigella dysentery type 1 and include pericarditis, toxic neuritis, conjunctivitis, parotitis, and in children, intussusception. Hemolytic uremic symptoms may occur as a complication in severe cases. The severity of the disease may vary from acute fulminating dysentery to mild diarrhea. Laboratory diagnosis. Diagnosis is made by isolating the bacillus from feces. Fresh feces should be inoculated without delay or transported in a suitable medium such as charged for glycerol saline and gram-negative broth, pH 7 to 7.4, which are less inhibitive for Shigella. Gram-negative broth is a selective broth used for culturing Shigella from stool specimen. It contains sodium dioxide to inhibit gram-positive bacteria and early replication of non-entry gram-negative pathogens. This should be subcultured 6 to 8 hours after incubation. Rectal swabs are not satisfactory. Microscopy it shows plenty of pus. So cultures for inoculation, it is best to use mucus flakes if they are present in the sample. McConkey and TGA or XLD plates or inoculated after overnight incubation at 3 to 7 degrees Celsius. The plates are inspected for pale or pink colored colonies which were identified by biochemical reactions. Any non-motile bacillus, that is urease, citrate, there are HDS and Keystone negatives should be further investigated by biochemical test. Identification is confirmed by slide accumulation. Slide accumulation with the polyvalent and monovalent sera. Another selective media used for isolation is the SS-agar where colonies are colorless. Then hectoendric agar also contain bile salt. Bile salt as inhibitory agents and some dyes to do which colonies appear green with color fading to the periphery. Serology. Demonstration of antibodies in a sera is not useful. Treatment against Shigella. So uncomplicated shigellosis is a self-limiting condition in which the patients usually recover spontaneously in a few days. However, in acute cases, particularly in infants and young children, dehydration has to be corrected promptly. Oral rehydration is adequate in most cases. Protein antibacterial treatment is not indicated in dysentery. Multiple drug-resistant plasmids are widely prevalent in Shigella. Indiscriminate antibiotic treatment will only worsen was the problem of drug resistance in intestinal bacteria. Antibiotics should therefore be limited to severe or toxic cases and to the very young, debilitated and aged. The choice of antibiotics should be based on the sensitivity of the prevailing strains. Many strains are still susceptible to nalidixic acid and norfloxacin and other fluoroquinolones. Thank you for watching this lecture class.